All right, today we're going to be covering a specific topic on ankle sprains, the types of ankle sprains that tend to occur, some of the mechanisms of injuries, specifically how rolling your ankle or everting it will cause damage to specific ligaments, tissues, and even osseous structures. I'm going to give you kind of a non-typical case in this situation on what may occur, some of the findings, some of the radiology reports, and some of the things that we may see, so you can know how to better handle it, how to go into it, knowing what to expect, some of the signs and symptoms of an ankle sprain, so that way you know what type you may have. So here we have a 18-year-old female that presents with complaints of right ankle sprain. It has been going on for about 1 month duration. The injury occurred when the patient was running around her car and slipped, suffering an eversion type of injury. She went to the local ER on that day of injury. So some of the things that we can ask ourselves is, what exactly is the difference between inversion and eversion? What would you expect to see in the patient's presentation? And what procedures would you expect the ER to take? So here we have a eversion versus inversion type of sprain. So as we can see that on the inversion side, it's kind of a sprained lateral of the ligaments, kind of a normal, and then here is what would be a eversion, which is sprained on the middle or medial side. So something that they kind of use a lot are what they call the Ottawa rules for foot and ankle radiographic series with patients in acute ankle injuries. So these are kind of just the rules of what would follow. These are just kind of the rules of what would need to happen in order to order an x-ray of the foot when talking about an ankle injury, specifically an ankle sprain. So an ankle radiographic series is required only if the patient has pain in the malleolar zone and any of the following findings. So that would be bone tenderness at the posterior edge, tip of the lateral malleolus. I'll kind of go over all these areas in a bit. Bone tenderness at the posterior edge of the tip of the medial malleolus, and the inability to bear weight both immediately and and the last one is inability to bear weight both immediately and in the emergency department. So bearing weight is just kind of standing on your foot. You feel like you're going to collapse. Your body's kind of stopping you from that using, the pain response. Now the other series where it would be ordered, where is a foot radiographic series, is required only if the patient has pain in the midfoot zone and any other following findings. So bone tenderness at the base of the fifth metatarsal. So it's kind of the base of where your little pinky toe is on your foot, a little bit lower than that though. So bone tenderness at the navicular, and the inability to bear weight both immediately and in the emergency department. So here we have an eversion sprain covering the certain aspects of what we might see and some issues in the areas. So here we have an eversion sprain, and it's kind of showing you the medial or the middle side of the foot if you're looking at it from between your feet and your foot was put on like a stand. Some of the common symptoms that we may see is immediate pain on the inside of the ankle, rapid swelling or bruising, difficulty with bearing weight, and limited ankle mobility. So pretty much you just can't move it. You have a tough time putting weight on it. There may be some swelling or bruising depending on what type of ankle sprain you have. So here's covering the inversion sprains. Some of the symptoms are similar. Limited ankle mobility, pain on the lateral aspect of the ankle, bruising may or may not be present. Like I said, just depends on which type of ankle sprain you have, and pain with bearing weight are the most common ligaments that will be affected with a inversion ankle sprain. So you kind of just roll your ankle out, so you're kind of flexing and kind of rolling it out that way, or rolling it in that way, would be the first one that's most commonly affected is the anterior talofibular ligament and the calcaneofibular ligament. And it's most common, and it's important to note that 90% of all ankle sprains occur to damage to these two ligaments. So if you do have an ankle sprain that is inversion mechanism of injury, these are most likely the ligaments that will be affected. Now the one that's less commonly involved is the posterior talofibular ligaments. These are just tend to be a little bit stronger. You can see that the bands are a little wider, and that it's not in an area that you would roll easily or hurt easily if you did roll your ankle. So kind of going over the types of different grades for ankle sprains by their grade. So we can see that grade 1, the tendon doesn't have any tears. The loss of function of ability is minimal. Pain minimal. Swelling minimal. Ecchymosis, that's just another word for bruising. It's usually not present. And then difficulty bearing weight, they don't have any difficulty bearing weight. Now grade 2 is where we see a partial tear in any of these ligaments. Some loss of function. Pain is moderate. Swelling is moderate. and there tends to be frequent bruising in the area. And sometimes they usually have difficulty bearing weight. Now, grade 3 is where we have a complete tear of any of those tendons. They lose a lot of function. The pain is severe, swelling severe, lots and lots of bruising, and almost always do they have difficulty bearing weight.